Hey guys, Ashley with Amare. So few resources for you guys. We are located in Elizabeth and Highland Park, New Jersey, and I also offer virtual consults. So if you guys need my help, give the office a call, 732-841-0142, and our scheduling coordinator can help you get set up with an appointment. We also have our online shop. So all the products that I talk about in my videos, those are all in our online shop for you guys to purchase. On our Instagram, Amare Healing Arts is our Instagram. All the products are linked right there in our bio. Also, the online shop is linked, and it's linked in the description box for each video. So you guys can go and check those out. And then we have our online course school, the Post-Op Academy. So all of the things that you would need to know post-op, we are doing online courses for. So things like what kind of massages you need, when you need to get them, who to get them from, how to find a therapist like me, all of that we have online courses for. There are going to be more courses coming out all the time. So check in on that to see what's new and what you guys can learn. If you like my videos, all of those courses are exclusive content. All those videos are exclusive content. None of them are on YouTube. They're all in our courses. So that is amarehealingarts.teachable.com. The link for that is also in the description box, and it is also linked in our bio on Instagram. So I hope you guys enjoy the content. Ashley with Amare. I will see you soon. Bye.
Hey guys, it's Ashley with Amare. Hello. So today we are going to talk about something that you guys ask all the time, that you're super afraid of. Can the fat come back after liposuction if I gain weight? Or the other side of this question, so two-part video, same answer, two questions. Will I gain weight in other areas more after liposuction? So the answer is yes. Here's how it works. Before I read, I have 3 articles. One is from the Mayo Clinic, one is from plasticsurgery.org, and one is an actual medical journal. So I have had so much fun looking this up. You guys know I love my research. So yes, here's how this works. Your fat cells are a cell, like a battery. Okay, so they either get depleted and they shrink, or they get full and they're large. Where do they come from? So when we're a child, when we're growing, when we're being fed, that's when we're developing fat cells all the way up into like puberty. So if you are someone whose parents overstuffed you, you will have more fat cells because your body had a lot more nutrients and you were getting like me, force-fed food, and you'd get beat if you didn't finish the entire plate, even if you threw up, where your body is then making all the fat cells to store all of that food. So you'll have those for the rest of your life. Now, this is why it's so hard for some people to lose weight, because you'll lose weight, and then the minute you stop working out like a maniac or being on a strict diet, those fat cells start to fill up again because they're there, because they were put there while you were growing up and while they were developing. So that's how fat cells work. This is why liposuction does work. And this is why when you guys are like, oh, she got lipo, oh my God. Some people do. So the actual like medical term for liposuction is a lipectomy, which is where they are sucking out, and I think that it's mentioned in one of these articles, where they're sucking out fat cells, right? They're taking out fat cells. So it's used, originally liposuction was used for like extra little fat pads, or it's used clinically in lipedema, which is painful fat syndrome, which is where your body just continues making fat all the time. So remember, I just said that from childhood all the way up until like puberty, a little bit into like, let's say like your late teens, your body is still growing and developing and making new fat cells. With lipedema, your body doesn't stop doing that. It just keeps going. So it's a disease, it's a disorder, and liposuction is used to remove those fat cells. But getting lipo is not a bad thing, because again, if when we are younger, all those fat cells are being forced to develop, those aren't going to go away just by exercise. They're going to shrink, and they may stay small if you, like I said, have a strict workout regimen, and your eating is on point and you're drinking a lot of water. You can keep them under control, but they're not going to go away. So melting the fat is depleting that battery cell, but it's still there. Liposuction is taking the cell out altogether. So when you go after liposuction and you're gaining weight, let's say you had lipo in your abdomen, right? Just something easy in your abdomen. You're not going to have cells there to fill up as much. You're still going to have fat cells, right? Visceral fat internally, as well as whatever subcutaneous on top fat that they left over, because you have to have some fat with liposuction. Those cells you don't have as many cells, so you're not going to see the weight gain as much in that area, which is why you do gain weight in other areas, because those cells are full and they're there. And when you eat, because the nutrients isn't going, or the fat, let's just say fat, isn't going to your stomach, it is going to your stomach, but there's very little cells there. So those cells are going to fill up, but then everywhere else that you didn't have liposuction is going to fill up more because you have more cells there in those areas to fill up. That's one part of it. The other part of it is proportions. Your waist is smaller. We got surgery there. Everything else is going to look bigger. It's proportions. Think about a vase. The bottleneck of the vase is going to look really tiny, and it's going to make the bottom of the vase look really big, and the neck of the top, the mouth of the vase look really big, because that tiny little neck is a small portion. So when we take a block of marble and we're sculpting it, we want to make sure it looks pretty and sculpted and proportionate. But that also means that we're going to make it's going to make it look like the bottom of the vase is bigger. If we start with a regular vase, right? And we, it's proportionate, it's got that nice curve to it, right? Or like a Coke bottle. If we shave off from that neck or from your abdomen of that Coke bottle, it's going to make the top and bottom look bigger. So that's another part of it. But if we're talking 6 months to a year out, 2 years out, when you're gaining weight, you're going to gain it in those other places first. That's not to say that you won't gain it in your liposuction area. You will, but you're going to gain it in those other areas first, like your arms, your legs, your butt, your hips, things like that. Women, boobs, right? Because we have a lot of tissue there. We have a lot more cells there. So those are going to fill up faster and first, as well as the stomach area filling up as well, the lipo-abdominal area. It's not like first, second, or third. When I say first, I mean like faster, if that makes sense, or more volume. Because again, you do still have fat cells in those areas. It's just that you have less fat cells. So you're going to notice less of the weight gain in your liposuction area versus all the other areas of your body where those cells are exactly where they were before and they're inflating because all of the fat in the lipo area was taken out. So you don't have as many cells to inflate, if all of that makes sense. So yes, you can gain weight after liposuction. Your body will eventually, if you're talking about 30, 40 pounds, your body will eventually start, like you'll see those cells in your stomach or that weight in your stomach come back. If you're talking about extreme weight gain, that's a different story. But for the average person, when you're talking about gaining 10 pounds or maybe even 15 pounds, you're gonna see it more in the areas you didn't have the lipo done. Not to say that you're not gonna see it in your lipo area, you are. It's gonna be way less, and it's gonna make it look like in your mind, oh my God, my legs and my arms are so much bigger. I'm gaining weight there and not my stomach. Again, proportions, bringing it back full circle. It's not that you're not gaining it in your liposuction area. You are. You're just seeing it more in the other areas because you have more fat cells there. So let's get into this. Mayo Clinic discussion / Mayo Clinic and understanding of liposuction. So it says, Dear Mayo Clinic, it's part of the article, which I think is really cool. Dear Mayo Clinic, how long after the effects of liposuction supposed to last, and how does it affect the skin around it? Is it true that if you get liposuction in one area of the body, the fat will eventually move to another area? That is incorrect. Fat doesn't move. Your cells fill and expand, or they deplete and shrink. So it's not moving. It's just what's there is taking on more because there's more there to take on. So answer. Liposuction is a permanent removal of fat cells, but getting liposuction does not guarantee permanently stable weight over time. You can still gain and lose weight. Although the fat cells do not move, if you gain weight after liposuction, other areas of your body unaffected by the procedure may get bigger than they did with previous weight gains, which is what I was just saying. The medical term for liposuction is suction-assisted lipectomy, which is what I said in the beginning. This surgical procedure removes fatty deposits in specific areas of the body, such as the abdomen, hips, thighs, arms, or neck. As adults, this is also what I was explaining to you guys in the beginning. As adults, we have a fixed number of fat cells in our bodies that grow and shrink as we gain or lose weight. The number of fat cells themselves is stable. This means that the removal of fatty deposits and the fat cells that make up the deposits is permanent, and it has a permanent effect. So again, exactly as I was just saying, you have a fixed number of cells in your body. Let's quantify this. If you have, let's say, 100 cells in your abdomen and 100 cells in your legs, just take legs in general, or hips, right, in general, and you suck out 80 of them from your abdomen, but you still have the 100 in your hips, when you eat a piece of cheesecake, I'd say, okay, so we're doing 80. So 80% of that cheesecake is going to your legs, 20% is going to your stomach, because all you have is 20% fat cells left to fill up in your stomach, but you still have 100% in your legs. So all the rest of that cheesecake is going to go into your legs, and those cells are going to enlarge. That's how it works. So let's go over to plasticsurgery.org. Can fat return after liposuction? That's the name of the article. This paragraph is Can Fat Return? So I'm going to read the whole thing. Unfortunately, it is possible for fat to return after liposuction if you allow it to come back. In general, the more weight gained by a patient after liposuction, the less dramatic their results will be. Fat will not return, and then parentheses, an ideal result will remain intact if the patient maintains their post-lipo weight. For example, if a patient weighs 130 pounds prior to liposuction and had a total of 6 pounds removed through the procedure, fat will stay away if the patient maintains their weight at or below 124 pounds. If the patient gains a small amount of weight after their procedure, say 5 pounds, fat cells through the body will get a little bit bigger. So again, those 5 pounds is going to get distributed through your body, but because there's more space in the part that you didn't have liposuction, more of it's going to go there. While this slight weight gain can diminish results, the overall improved body shape provided by liposuction procedure will still be visible as treated body areas have less fat cells, and thus experiencing a lower enlargement rate compared to surrounding areas. Finally, in case of considerable weight gain, i.e. 10% of their body weight, new fat cells can develop in other areas of the body, including treated areas. However, since new fat cells creation typically occurs in an even manner throughout the body, fat often accumulates less in the treated area compared to the untreated area. Thus, many liposuction patients who gain considerable post-op procedure weight tend to still look better than if they did not undergo liposuction. So what are they talking about as far as new fat cell creation? Your body, like we said, you have a defined number of fat cells, but like they said, 10% of your body weight, right? So and like I said in the beginning, if I'm 120 pounds, if I gain 20 pounds, yes, it's not just going to all go into one area and engorge, because like they said in this article, fat is evenly distributed throughout the body. So if we're putting an even 100, but we've only got the 20 cells here, 20 of it's going to go there. The other 80 is going everywhere else. So it's going to make it look like you gained weight everywhere else other than that lipo area, but you're also still gaining weight in that area. Now, again, like they said, considerable amount of weight gain, your body is going to expand. Those cells are going to not come back, but you're going to make new fat cells, or the cells that are in that area are going to get very enlarged. So that answers the first part of the question. Can my weight come back after liposuction? Absolutely. But we're talking about a 10% gain here. So like 20 pounds, 30 pounds, 40 pounds, 50 pounds. That's what we're talking about to really start seeing that lipo area regaining, in air quotes, regaining that fat. Going to our National Library of Medicine, we have an article here. Hold on, let me see what the name of the article is so I can tell you guys. I gotta scroll up. Long-term effects of large volume liposuction on metabolic risk factors for coronary heart disease. That's the name of the article, but it talks about a lot of different things in here that I really like. So, liposuction surgery removes billions of adipose sites, fat cells, from selected adipose tissue, fat, deposits and disrupts the connective tissue framework that supports adipocytes and other adipose tissue cells, fat cells. Therefore, it is possible that fat, in parentheses, gain after liposuction could have adverse cosmetic and metabolic effects in the newly formed TGs that are unable to accumulate in the aspirated areas. Pause. What does that mean? So when it talks about possible weight gain after liposuction having adverse cosmetic, which is the look that we're talking about, and metabolic, which is your actual like health risks for the newly formed cells that are unable to accumulate in the aspirated areas, are redirected to other sites. So what that means is this is the second part of this video, what I was saying, when you do gain weight, because you don't have those cells, which is what this is saying, you will gain weight in other areas. Now, we know this, I've said this a million times, but let's talk about visceral fat for a second. And I'm gonna do a whole video on visceral fat versus subcutaneous fat and what the heck that means and why not everybody's a candidate for liposuction. So visceral fat is the fat that surrounds your organs. It's the fat that's behind your abs. Subcutaneous fat is the fat that's on top of your abs. The stuff you can pinch and grab, that's subcutaneous. The stuff that's underneath your muscle, that's visceral. Those surround and protect your organs. So when we're talking about gaining weight, guys, it's not always on the outside. It's sometimes on the inside too. So a lot of times what happens is you'll gain weight from the internal, underneath your abs, and have like a belly, like a poofy, not hard, but like a poofy belly, like a big round belly. That can be visceral fat. That can be internal. And when you're talking about gaining weight after liposuction, it could be a lot of visceral fat that you're gaining, not something they can go and redo with the lipo because it's not on top. They can't get to it. So that's one of the things that this article is talking about. And then it says, right, the aspirated areas and are redirected to other sites. So because there are no fat cells here, it's redirected to other fat cells in the body, that weight gain. However, the effects of liposuction on fat distribution and metabolic outcome after subsequent weight gain in humans is not clear. Data from studies conducted in lipectomized animal models, so talking about animals, demonstrates that regeneration of the removed fat pads is rare, but compensatory, so like other fat, fat accumulates at other sites commonly occur. So they are saying that studies conducted in animals who have had liposuction, basically, the fat rarely accumulates in the same area it was liposuctioned out of. It starts to accumulate in other areas. But they're saying that they haven't done enough studies, this article anyway, medical journal, that they haven't done enough studies on people, which, you know. So information obtained from this case report in patients is consistent with the findings in animals. So like they just said, what they found in this report is consistent with animals, and suggests that weight gain after liposuction results in an increase in subcutaneous, now we know what that is, right, on top, outside, subcutaneous fat in areas that were not aspirated liposuction, such as the back and breasts. So this is what I was saying before. You're going to, anywhere that you naturally have fatty tissue is going to expand first. Then the liposuction area a little bit, but more so in those other areas. And this is the big thing. So now that we know all about this, right? Subcutaneous fat, visceral fat, you can regain fat in other areas. It does happen. I have seen it happen. This is why some people go in for round 2, round 3, round 4 of lipo, because it's not always on the same area. Sometimes they'll go in for their back. Sometimes they'll do a breast reduction. Sometimes they'll do their thighs and their arms next, because those areas are gaining weight faster and more than the lipo area. It's not that the lipo area like isn't gaining weight at all. The little cells that are in there will expand, but everywhere else is expanding at such a bigger rate. Now, here's the other thing I want to talk to you guys about. And this is, now that we've gotten all that information out of the way, you guys do not finish your aftercare. You guys don't finish. You guys heal and still have swelling inside of you. You get to a point where you're like, I've tried so many massages, none of these are working. I guess this is just my result in the end. No, It's not. If you have someone that's a certified manual lymphatic drainage therapist, if you understand what manual lymphatic drainage massage actually is and how it works and the science of it, you would know when you're done with your massages. Not just, I guess I'm done. No, you would know. It would be a concrete, oh yeah, there's no more swelling here. I'm done. I'm good. Not, I guess it's just fat that they left over, that they missed, or like, I just don't feel like wearing my garment anymore. I guess these are just gonna be my results and I'll live with them. That's not being done. That's quitting. There is a difference. And if you are quitting, something's not working. That's what's going on. Either your garment's not right, the massages you're getting isn't manual lymphatic drainage, even though, yes, they can claim it till the cows come home. If they don't know what they're doing and they're not properly trained and you don't know what they're supposed to be doing, it's how are we gonna know? So obviously watching my videos, you kind of know. But you guys give up and you're still swollen, and then your tissue heals with swelling inside of it. And then you swell. So it's not that you're gaining weight in that area, unless, like I said, unless you've gained like 30, 40 pounds. If that lipo area on your abdomen keeps fluctuating and you're like, oh my God, I'm so bloated today. I don't understand. Like, oh, this is looking worse than it did. And I'm like 6 months out, I'm a year out. I don't understand. I must be gaining weight in my lipo area again. I must need to go and get more lipo done. No, swelling fluctuates when your sodium intake is too high, when you're not drinking enough water, and if you have swelling in your lipo area to fluctuate. Guys, this goes for any surgery, okay? If you are doing this little like up and down fluctuating thing where like, and I mean like day to day and week to week. I'm not talking about over the course of months. I'm talking about it's 3 months out, you stop doing your massages, you stop wearing your garment because you think it's all like just whatever. I'm 3 months out. The timeline is the timeline, which is not correct. That is false. There is no actual timeline. If you watch enough of my videos, you know that. There is no like magic number day that you're just done. It's when your body no longer has swelling, when your tissue is no longer heavy, when you actually see your results. So you guys get to that point and you're just like, I'm just over it. And then like literally day to day, week to week, you're bloating, you're swollen, you think it's fat, and you're just like, it's whatever, it just is what it is. Rather than looking for, I don't know, a plastic surgery recovery specialist like me to actually tell you and like look at you and say like, yeah, it is or yeah, it's not. Or going back to your surgeon and they say, oh, it's swelling, just wait a couple months. Okay, well, instead of waiting a couple months, why don't we actually find someone to help with this to get it off? Because if you don't, it will heal inside of you. And then you'll think you gained fat in your lipo area. And then it will fluctuate every time you swell around your cycle. When you swell, if you have like a cold, if you, like I said, have way too much sodium, you'll get like sore and tight, or your abdomen will just blow up out of nowhere. Guys, you do not know how to tell the difference between swelling and fat. I have a video on it on my YouTube. You guys can go look for it where I explain it to you. You don't know how to tell. And then you think, oh, the fat just came back or the fat moved around and there it is now. No. It is very, 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 very possible that you never got rid of the last bit of your swelling. It healed within that interstitial space. When that space healed, that tissue space that you had surgery done, it healed within that space. And it's anything that you have that would cause you to swell, it expands. And then you don't have those things, and then it goes back to being its normal size. And over and over and over and over, we're rebounding back and forth. So here's how it works. If you have no more swelling in that space, you can do anything you want and it will not fluctuate. If it is fluctuating from day to day and week to week and you're noticing a big difference, you need to find yourself an actual manual lymphatic drainage therapist, someone like me. And I mean, you guys can set up virtuals with me. You can come in to see me in New Jersey, or better yet, honestly, because it depends on what you actually need. But taking our course, the post-op lymphatic massage and finding a therapist, I teach you guys in there about swelling. I teach you guys in there about when to do your massages, how to know when you're done, what credentials your therapist is supposed to have, what exactly they need to be doing with their hands in the room on you, where they need to work in which areas first in order to get your body to actually reabsorb the swelling and pee it out, what the drainage part of manual lymphatic drainage means, the science of it. Guys, listen, if you think that the fat is coming back, okay, if you think that, let's say you're 4 months out and you're like, oh no, the lipo just didn't work. Oh no, the fat's coming back. Take the course, because you will learn that that is not correct. And then you will also learn how to find somebody to help you fix it. Or set up a virtual with me if all of that's still a mess for you. But that's not the case. I have somebody who is now 3 months out, went back to her surgeon literally Friday. She just saw me today. She went back last Friday, and he told her on her back, and she knows because her surgeon also told her, oh, don't worry about your massages. You can go back to work. You don't need to do anything. You're fine. This woman had her entire Lipo 360 area rock hard with fibrosis because she didn't have a proper garment, she didn't have foams, and she wasn't getting her massages. And on top of that, the surgeon told her not to do anything, so she didn't do anything proactively. So all of her swelling sat in there, stagnated, became fibrotic. We got rid of it, right? She got back to work, scheduling got crazy, didn't come in for a while. Saw her surgeon on Friday, and she's like, I'm not happy with my back. It looks like nothing was done. These bra rolls are still here. I don't understand. It feels like fat. She kept saying to me, literally, no matter what I said to her, it feels like fat. I think it's fat. No, I think it's fat. No, I need a revision. And I'm like, all right, well, you know what? I've explained to you the science. I've shown to you that it's going down. If you really want the revision, go and get the revision. Okay, right? So she goes back on Friday, and he tells her, oh yeah, we can go in there and be more aggressive if you'd like to get that out. And she's like, what the hell? No, you were supposed to be aggressive to begin with. I'm not going under again. Absolutely not. So she comes in to see me. Literally after one session, it all flattened out. Why? Because it was swelling. It wasn't fat. No matter how many times I say it, it's swelling. The fat cells were taken out. Now, caveat, sidebar. Are there cases that I have seen and worked with where, and again, I'm very straightforward with you guys. I'm very candid. When you come in, if I feel it and I'm like, okay, yeah, it's definitely fibrotic, it's definitely swollen, but I can feel where the end of it is and I can feel where the fat is, I'll be like, okay, what did you and your surgeon talk about? How much of this did you guys agree to take out? Because I think that it wasn't as deep as you would have liked as far as taking out the fat, but the work was still done. And you have to wait 6 months anyway. So let's get the rest of the swelling off of you so we can see where your baseline of fat and tissue is. Because with all the swelling and everything on top of it, we don't know what's fat and what's not. I can't tell. But I can tell you when it's swelling. And if it is fluctuating from day to day and week to week like that, it's swelling. Because fat cells enlarge over time and you can gain weight over time, but it's not going to be day to day. That's swelling in any case where that's happening, where it's like a huge flux like that, where you see it, it's noticeable. That's swelling. That's not fat. And hers was the same thing. Fat is soft and squishy. Swelling is thick and heavy in your tissue. So like your breast tissue is soft and squishy. If you poke, you can feel the granules. You can feel all the way down there. It's really, really like soft and squishy. Your arms, right? Even though there's muscle tone in here, you can feel like the fat in there, the squishiness. If this is heavy and thick and hard, that's not fat. You've got swelling in there. Anywhere, like, your abdomen, everything like that. But if it's fluctuating like that, it's definitely swelling still. Yes, there may still be some fat under there, but there's definitely swelling on top causing the fluctuation. And that is not weight gain. That is swelling you never got rid of because you did not find the right person to do your sessions. You did not have the right garment. You never finished your post-op care. You never took it into your own hands because you didn't know what to do, which is why I'm saying go get the course. If you are in this situation, go to our shop, amarepostopshop.com. It'll be linked in the description box. It's on our Instagram. It's linked on there as well. So you guys can go and purchase it. But if you're having this problem and you think the fat's coming back, and you're still within that first year and you're fluctuating, or if you think you're still swollen and you don't know what you did wrong or what you didn't do, go get the course, because I cover every base in there, and then you guys will be able to see, oh, this is where I messed up in my protocol. Okay. Oh, okay. This is what I was doing wrong. Oh, okay. This is how to fix it. This is what I need to be doing. Oh, okay. This is who I need to be going to. And you guys can fix it on your own. That's the point. If you do that and you're still not sure, if you want to see me first, you can call the office, 732-841-0142. You can set up a virtual with me. If you're not in New Jersey, we can have a conversation. I can point you in the right direction. I will go through your protocol with you and we'll figure it out. And then if you are in New Jersey, Highland Park and Elizabeth, same number, 732-841-0142. And you guys can come in to see me and we'll figure it out. I just posted on my Instagram a picture of a facelift that was done 10 years ago. And she thought the same thing. Oh, my jowls. Oh, it's just fat. Oh, I might need to go get something done. Maybe it's the Botox and filler that migrated, blah, 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 blah. And I felt her face and I was like, no, that's swollen. That's like 100% swollen still. She was like, yeah, I didn't do any massages. I didn't wear the garment because it was uncomfortable. I don't know. I just didn't want to. And yeah, I had an eyelid lift like 6 months later. And then, yeah, I had another facelift, like a deep plane facelift, like, you know, a year after that. And I'm like, you had 3 surgeries of face swelling and did nothing. Yeah, you're still swollen. So her results are on our Instagram if you guys want to go check that out to see what I'm talking about, how it literally like melts off in an hour when you have the right person. That's not fat, that's swelling. But again, there's a lot of different things that you guys tell me that is not even medically or physiologically, biologically possible. So this is what is possible. Yes, you can gain weight and will gain weight in other areas where surgery was not done more than your lipo area. You will see an increase in weight in other areas of your body that did not have liposuction after liposuction. Yes, if you are talking about gaining 30 pounds, 20 pounds, 40 pounds, you will see the weight come back, I use quotes, come back in your abdomen, because whatever fat cells are there are getting very enlarged. So you will see an increase in weight there, but then you're also going to see that 20, 30 pounds everywhere else, like a lot everywhere else. Can you still be swollen and it fluctuate? Does weight fluctuate from day to day like that? Like that crazy, like bloat where it's visible? No, that's swelling. Can you mistake fat for swelling? Absolutely you can. Do you need a revision? I don't know, because that's the next thing I'm going to get. Everybody's going to be like, oh my God, well, what do you think? You're going to be in my DMs. Call the office, set up a session with me. So guys, I hope this was helpful. That's how that whole thing works. And it can start as soon as 2 to 3 months, like you're gaining the weight. And this is why it is so important for what you set up with your post-op care to be a tried and true thing as far as your nutrition, which I do cover in that course, but I'm going to do a whole other course on post-op nutrition for you guys as far as like for swelling, nutrition for swelling. Because there are a lot of post-op nutrition things out there where they're like, this is good for, antioxidants. This is good for amino acids. This is good for wound healing. But nobody talks specifically about the foods that you're eating that are causing swelling. Foods that you're eating will not take down swelling. That's not how that works. The only thing that gets rid of swelling, gets swelling out of your body, is your lymphatic system, which is why you need your manual lymphatic drainage massages. It is a one-way system. Your lymphatic system is responsible for taking swelling out. That is it. An injury, a surgery, anything, swelling event will cause swelling, but your lymphatic system gets rid of swelling. That's how that works. So manual lymphatic drainage massage gets your body to reabsorb the swelling, stimulating that body's natural one-way system of getting it out. So foods that you eat will not decrease swelling. They just won't make the swelling that's in there more and angry and thick and expansive. So I'm going to put that whole thing together for you guys probably next year, because the next course we're coming out with is your fibrosis course. So explaining fibrosis and how to get rid of it. But I already talk about that in the course that we have now. If you guys are struggling with fibrosis and you're still hard, definitely check out our course now, because I explained to you how fibrosis starts as swelling, how to make sure it doesn't turn into fibrosis, how do you get rid of it if you already have fibrosis, what you need to be doing to get rid of fibrosis. It's all already in there. And part of that is your manual lymphatic drainage massages, which you need to thoroughly understand what those are before you just go paying someone to rub you and then thinking that your swelling is fat and that your fat came back in your lipo area, which is why I'm doing this whole video. So guys, that's it. I hope this was helpful. I hope this made sense. I hope this answered that question. If you need me, like I said, call the office, 732-841-0142. The course, you guys can purchase the course and start learning everything and fixing your post-opness. That is amarepostopshop.com. You can also get your supplies there. So if you are struggling with swelling, your lipofoams and fibrosis, your lipofoams is the number one thing you need. Detergent to wash your garment and foams, medical grade detergent, guys. You have medical items on your body, you had a medical surgery, you need medical grade detergent or your garment's going to start deteriorating. Also, Tide, Gain, and all in those things don't disinfect your garment. Our detergent does. So supplies in general, those are amarepostopshop.com. And guys, I think that's it. I will see you all very soon. Ashley with Amare. Bye.